Hey guys, Coach Oz here. I get a fair number of inquiries pertaining to kind of the low back region in terms of looking for, I guess, advice on how to fix a tight back or low back pain, and without going into obviously all the details of and areas of back pain for that matter. But I just wanted to kind of show you, literally two great, effective exercises that, for the most part, can really help to not only alleviate pain, but really kind of set the core and pelvis, ideally, in kind of more of a optimal alignment. And that usually does aid in both reduction of low back stiffness and certainly low back pain. And even these two exercises can assist with helping to, amongst doing other hip mobility exercises like hamstrings and quads and obviously inner outer thigh musculature, but even just by doing some simple core engagement can actually help even increase hip mobility. So like I said, when I hear people say, like, give me a low back stretch or stretch to kind of, take some of my low back tightness away, or you see people in the gym and they're using a foam roller or they, what's called the peanut, where they take two lacrosse balls or tennis balls and they kind of tape them together and there's a little gap in the middle to kind of put on the low part of your low back, and then you see people kind of more or less rolling into the deep kind of spinal tissues of the lumbar spine or lumbar area, which certainly, even though you may find some alleviation, just because the way those movements are going to really hyperextend. Because if you're on a foam roller, what's going to tend to happen, obviously, is if it's on the low part of your back, you're going to really hyperextend that low back area. And that's just not what a function. That's not a functional ability, or I should say position, that the lumbar spine should be in. And for most people that have tight low back muscles or pain in the low back or instability at the hips, SI sometimes, things like that, usually the back tends to be in that natural lumbar or lordotic kind of hyperextension curve. So putting your lumbar spine in more of a curve is really not going to certainly get at the root of the problem. So two little exercises here. One's called the RKC plank. Setup is exactly the same as a normal plank, but what you'll do is you're going to have kind of your fists together, and what you want to do is think about already when you put your forearms on the ground, what you're trying to do is draw your forearms kind of down towards your feet, and you're going to basically fully engage everything. So your quad muscles, your glute muscles, your core muscles, and of course your shoulders and your lats. And you're going to just basically fire everything up at the same time, and you'll typically go for about 10 or 15 seconds, and that's it. And then you can repeat 3 or 4 sets if you wish. But you set yourself up, really tuck the bum, fists are really clinched together. I'm pushing my forearms down, I'm squeezing my quads, really squeezing my glutes. As you can see, I'm shaking like I'm really get her going there. And then 10 seconds, and then, like I said, rest and repeat. And then your side planks, which obviously I've done in other videos, but it doesn't need to be anything fancy. You can put a kettlebell in your top arm here. You can obviously raise one leg. It doesn't really matter as long as obviously everything is nice straight aligned. But again, just as with that, the whole RKC plank is really fire up the glutes, really fire up the quads, kind of draw your elbow kind of down to the floor and then towards your feet, and keep everything there. Again, up 15, 30 seconds, both sides, of course. And just by doing front planks, well, the RKC plank, and then your side planks, many cases, without doing anything else, even in terms of, say, stretching for the hips, two things can happen, but more, one, like I said, you can gauge more hip mobility, flexibility, which is key. But overall, your low back tightness and certainly pain can actually alleviate significantly with just those two movements. So anyway, hopefully you may find, these movements, if you, like I said, implement them literally daily, you can, depending on, like I said, I guess the nature of how stiff your low back is, or if you do have daily discomfort. But you can certainly implement those exercises on a daily basis, doing a couple of sets, and just see if that works for you. Happy Monday.